box, which is found at the bottom of your screen. Selected questions will be read out loud during the Q&A portion of the session. And now, I would like to introduce today's moderator, Chandrima Das, who serves as Senior Director of Peace and Security Policy at the Better World Campaign at the United Nations Foundation, a sister initiative to UNA USA. Chandrima?
Thank you, Farah. And thank you for UNA USA for hosting today's panel and a warm welcome. I'm happy to be celebrating International Day of UN Peacekeepers with these esteemed panelists from across the world. This year, the UN is highlighting women, peace, and security as it's the 20th anniversary of Security Council Resolution 1325, which confirms the need for more women in peace and security, and research and common sense illustrates when women are at the table, peace agreements last. As part of these efforts, Pieces Online, there's an online photo exhibit of women peacekeepers fighting COVID-19. We've pulled a few photos to show you now. Before I introduce to you our panelists, I want to provide a brief overview of UN peacekeeping and the 4 missions that we highlight today. Currently, there are 13 peacekeeping missions, nearly 100,000 peacekeepers in civilian, police, and troops serving on the front lines, helping those caught in conflict, seeking security and a better future. Each mission and mandate is authorized by the UN Security Council, which the US is a veto-wielding member. We will be hearing from women serving in very different capacities in different missions. The mission in Central African Republic was set to prevent mass atrocities and support democratic elections and assist the ongoing peace process with armed groups. The mission in Mali was deployed after extremists took over large swaths of the north, imposing strict Sharia law and began moving towards the capital of Bamako. The mission in South Sudan opened its bases to protect civilians during a civil war in 2013 and currently are supporting a transitional government and peace process. And the mission in Kosovo was deployed after the conflict in the Balkans to support a new government, maintain peace, and facilitate inclusive society for all ethnic groups. I've had the opportunity to visit 7 UN peacekeeping missions and witness the work of UN peacekeepers deployed in some of the most fragile places in the world, serving those most vulnerable, protecting communities living in fear. In the midst of these challenges, these women are now helping to fight a global pandemic and are providing the same communities with resources to prevent the spread of this deadly disease. Currently, there are 96 confirmed cases of COVID-19 across UN peace operations. These women are the best of UN peacekeeping and highlight how UN peacekeeping is always changing and adapting to meet the challenges on the ground. We have an incredible, you have the incredible bios of today's speakers, but wanted to briefly introduce you our panelists. We're honored to have civilian, military, and police perspectives here today. Our speakers include Rania Dagash Kamara, mission in Kosovo. She's the key enabler to getting everyone what they need to carry out the UN's mandate. We have Linnea Hanks, Joint Operations Officer based in Timbuktu. She's part of a team that provides situational awareness for the conditions on the ground. And we have Lieutenant Dr. Arya Suman Kadka, part of the Nepalese contingent in the United Nations mission in Central African Republic, serving in Bambari, patrolling and providing security in the region. So to get us started today, I would ask a question of all of you. How has your job shifted to address the COVID-19? And let's start with the police commissioner, if that's possible. Yeah.
Yes, a very good afternoon, Chandrima, and to our listeners. On the question of how our job has shifted with the onset of COVID-19, a lot has changed in terms of how we do our business. It's no longer the normal peacekeeping that we have been doing because with the onset of COVID-19, it brings with it a new challenge that we had to take on board so that we can be able to deliver to the best of what we can do in terms of the mandate that we are currently doing in the mission, which is protection of civilians. For police, when we are with our primary responsibility is more to do with, addressing the challenge of physical threat whilst protecting civilians. So with the onset of COVID-19, that has to change a little bit in terms of, although we're still protecting civilian against the physical threat, but then again, it's a new threat that we need to also take on board and prepare ourselves for, which is the COVID-19, particularly for the peacekeepers, because our primary responsibility is also the safety of the peacekeepers, and at the same time, the community that we are serving here in South Sudan. And the challenge that we have to maintain the delivery of our mandate together with addressing COVID-19, bearing in mind that in our primary responsibility to deliver the mandate, that we are not also at the same time putting the civilian at risk in terms of cross-infection of COVID-19. So these are the challenges that we had to deal with, and we had to change in terms of what we are doing so that we can do these things differently and be able to at the same time deliver our mandate and also be able to address COVID-19 with the communities of South Sudan.
Thank you. Can I turn to Sandy next?
Yes. Hi. Thank you. I'm most humbled to be part of this discussion, be with a wonderful group of fellow peacekeeping, strong, beautiful women. When did your life change with COVID? For me personally, in Kosovo, 13th of March was a game changer. 13th of March, we got the first 2 cases of COVID, confirmed cases here in Kosovo. At UNMIC, we established a COVID task force under the leadership of our deputy SRSG. And on the 16th of March, we went into lockdown. Next thing you know, 1.8 million people in this our part of the world, all the borders are closed, and we all started working from home. We activated our business continuity plans, safety security plans. Me wearing my crisis management team leader hat, we started streamlining our decision-making, doing risk mitigation, and establishing new governance structures. Now, how do we help the local authorities? I'm very proud of the fact that I am working for the UN, and the Secretary General has said very clearly that we're in this together. We stand in solidarity with everyone. Our head of mission, Mr. Tanin, asked us to look at our mandate and do contingency planning and see within our mandate, how can we support COVID response? Within the areas of trust building, human rights, women peace security, youth peace security, and trust building, we went ahead and repurpose our programmatic activities. We work closely with the UN Kosovo team. Through the WHO network, we're part of the local response plans, and we're plugged in to K4, OSC, and ULEX under the leadership of our head of mission. We have just finished distributing to all of the municipalities here in Kosovo food packages and hygiene packages. We're now finalizing the plan to deliver personal protection equipment, as well as tablets for children so they can do online learning. We did this all together by looking at our plans and seeing how best we can support the most vulnerable communities. Now, the other thing that we helped the Kosovo government was there's only one clinic here which provides the COVID testing. And while they were waiting for donations for PPE, there was one critical weekend that they were going to run out of personal protection equipment. And through WHO, they approached our mission, and we were able to do a very critical donation for that weekend and cover the gap. Now, how are we able to do all of this? And what is my support within the overall COVID response for UNMIC? Well, I'm lucky that I've made my career from crisis management. Before coming to UNMIC, I was in Syria, I was in South Sudan, and in New York 6 years ago, I was the team leader for crisis response for Ebola for all of peacekeeping. Now, if you take a step back, when it comes to a crisis, what is the most important thing you need to do? Number one, you need to take care of your people. Here at UNMIC, we ensure that we accounted for all of our staff and their dependents here in the mission, and for those who were traveling outside on annual leave or business, and they are all accounted for. As I speak right now, since the 16th of March lockdown, we're all working from home. Only essential services are working in our headquarters. I stop by every day to lead by example and to say thank you to our security team, our medical team, central warehouse, transport, and other critical staff, our staff counselor. We have here at UNMIC, we have also ensured that our governance structures are in place and we have streamlined decision-making. We have activated a very good communication strategy. There is information overload, not only for me, for all of you out there who are reading the news, who are on Facebook, dealing with your families on WhatsApp. We are getting a lot of information from New York, our colleagues, for example, from Rania, and we're getting the best practice and lessons learned from admissions, and we are instituting them here. On the medical front, it's very important. We looked at what we have and what we need to improve. Thank Allah that our head of mission is a medical doctor, and under his guidance, we went ahead and bought new equipment and 4 ventilators, and we have turned in our Ebola response unit to a COVID-19 response unit within a month. We went ahead and got an ambulance on loan from another international organization, ULEX, for which we're grateful for. We hired 6 new medical staff, 2 doctors, 2 paramedics, and 2 nurses, and we have 24/7 response for COVID and non-COVID response. This is not only for UNMIC, it is for all of the U team here in Kosovo, also our Belgrade office. We have 3 offices. The social is important. We have a staff counselor. We have trained our staff to be peer helpers. We have volunteers for those who are under self-quarantine. We buy food and deliver food to them. We have a phone tree mechanism. We call each other and see how we are doing. Now, where are we and where are we heading? Yes.
Sorry, so that's incredible. I'm definitely going to come back to you because I have lots of more questions, but I wanted to just turn to our other colleagues as well. Do you mind if I ask Linnea, how's it going? How has her position shifted a bit since her time in Timbuktu?
Sure. Good afternoon, colleagues. Good morning. Good lunch break to my American compatriots on the East Coast and the West Coast, and in all over the country as well. Very happy that you invited me to join this panel and provide a bit the very field perspective up here from northern Mali. I only joined the mission, joined MINUSMA, the Timbuktu office, a few weeks before the pandemic started to really hit the region, hit Mali, hit Africa. The first cases were announced towards the end of March, and my kind of date where everything shifted was the 4th of April, which is when we had our first case confirmed in the mission, which was actually a colleague here in the Timbuktu office. This meant that my job shifted very rapidly from working in a very busy joint operations center where civilians and police and military work together to coordinate operations, to share information, to manage crises as they kind of come, which they do rapidly in northern Mali. Most of us were instructed to work from our container accommodation, which is what you can see here in the background. I was very happy to be able to remain here in Timbuktu, to be able to coordinate, as coordination is more important now than ever with people working from home. Our work shifting into crisis management happened quite rapidly. I started working a lot with the field office management to put in protocols to, of course, to protect ourselves, to protect our health, and make sure that we were not spreading the virus in the communities here. Obviously, Timbuktu is a very is a place with not great healthcare resources. So we worked hard to put in complete lockdown measures, including shutting the whole camp from outside employees coming in on a daily basis. However, we're a peacekeeping mission. We're here to provide security to the local population. So our operations do continue. Force is out there, and UNPOL is out there providing security. In terms of civilians, we've had to shift there how we work. Many civilians can continue their work by calling up their partners to support different activities, to coordinate on their phone, over the phone more than in-person meetings. We hope to be back to normal eventually, but we're rising to the challenge, and we're doing the best we can. Over.
That's great, thank you. And then can I turn to Dr. Katka for some brief opening remarks about how your job has shifted during the pandemic right now?
All right, thank you so much, first of all, to everyone who's listening right now. So how my job shifted, I would say that it has actually been no different than it used to be since, especially I'm a doctor. So we have been still doing the same, the work we have been doing is almost the same as it used to be before the pandemic. But however, yes, there has been few changes, of course. So my life changed a little, especially after 14th of March, which was the first time when it was declared in Central African Republic that the first case has been detected. So it was after that somehow the life of everyone over here, it went little towards a different direction. But how I would say is that in our role, rather than it has been no different, but it has rather in a way increased, because initially, if we talk about before the pandemic state, of course, the main mission was to maintain peace and security, especially for the protection of the civilian. But in addition to this pandemic, now after the pandemic, how in addition to this role, we also have to take like the necessary cautions, the preventive measures in order to not to spread the disease as well. So right now, how my role, the greatest role or my greatest responsibility right now is, since the activities are still ongoing, so to send the troops from the camp outside to the field safely, and to bring them back to the camp from the field safely as well, without acquiring the disease and without spreading the disease. So this is how the role has somehow shifted, and I think I'll be talking later more.
Thank you so much. And then can I turn to Rania just to give a couple of remarks about how your position has shifted to address the pandemic?
Thanks very much, Chandrima, and thank you also to UNA USA for this opportunity, and to be with my colleagues. A good morning and a good afternoon to those who are connected with us. So I see my job in two parts, really, Chandrima. The first is as a mom and a caretaker in this house. And I would argue that shifted considerably with the pandemic when schools closed and I had to maintain a toddler at home while trying to balance work as well. So it was a crash course in learning how to keep us safe and how to keep him entertained, etc. And I think that's been a very humbling experience, to be honest. Now, at work, my job normally entails doing two things as well. One is maintaining an overview of global trends and what that means for our peacekeeping operations. And with COVID, that definitely shifted into what are the impacts of COVID going to be on our missions? Will the socioeconomic impact and the financial potential loss that is going to affect us, what's that going to mean for our missions and how do we adjust? So I think there's definitely a lot of collective thinking on how to do that. And then more practically, a little on what Sandy touched earlier, the second part of my job is about learning and about capturing best practice. So we've been very active trying to take experiences from one mission to the other on how to keep our own personnel safe, on how government support has been extended also. Different missions have done it differently, and we've been quite busy linking our different missions together. So I would say that's been a very big part of how the shift has happened. Over to you.
Thank you. So I'm going to start with the police commissioner. There are now 3 confirmed cases of COVID-19 inside the protection of civilians sites within Juba, which is extremely concerning given that social distancing is very difficult in that environment. Can you tell us what UNMISS is doing to help stop the spread of the virus, including the role of UN police in this context?
Thank you very much, Chandrima. Yes, that's one of the biggest challenge of UNMISS, particularly with having the protection of civilian site, where it's really a challenge to be able to put into place or ensure that the social distancing and all these other protocols that are applicable in addressing or preventing COVID-19 spread. It can be very difficult because of how the protection of civilian site is made up, and in terms of its setup. One of the protection of civilian site with the highest number is 120,000 of IDPs, and 2 or 3 have about 30,000 population within the protection of civilian site. So it has been a challenge, real challenge for the mission. However, the mission had started way back, even before we recorded cases here in South Sudan, by engaging with the communities within the protection of civilian site in an effort to decongest the protection of civilian site. So engaging with the community in areas in which if they can return to their villages or to their communities of origin when it's possible or where it's possible, so that they can be able to to live in a community where there is no congestion. And that's what the effort initially, when the mission started with a prevention effort that it had started with. And in addition to that, there has been also a lot of engagement in the protection of civilian side, as well as outside, in terms of educating the communities. This is way back before we started to record cases in the POC side, and as well as outside in the community. By now, for South Sudan, it has recorded almost over 800 cases of positive COVID-19, and as you've mentioned, including the protection of civilian side. But the challenge we have is the fact that there hasn't been much testing, both in the POC as well as outside, and that poses a lot of risk, particularly for the POC residents, as well as the mission, because of our engagement in the protection of civilian side. So the mission has contributed a lot of work or a lot of effort in the prevention of COVID-19, and in providing some logistical support inside the POC as well as outside, also assisting the local health in providing 500 beds for hospital patients, new water tanks and boreholes, generators, all this support that the mission provided, both for the humanitarian as well as UNMISS and the development partners, in trying to put the country in position in which we can be able to address COVID-19, because we are fully aware that the health system is not in a very good condition, and we know that if it's overwhelmed even before that, it will be in a very dire situation here in the mission, and that's why the mission had really worked hard in supporting the government as well as the people of South Sudan, apart from the protection of civilian mandate that we have been doing. The PPEs is also a huge challenge, not only for the people of South Sudan or the partners that we work with in South Sudan, but also for the mission as well. But we've been very grateful for the support from headquarters in terms of providing us with the COVID-19 PPEs so that it can help us to deliver the work that we do. As I mentioned earlier in my introduction, the initial protection of civilian mandate with the PPE that we are given in terms of addressing the physical threat is different from the COVID-19 PPE. So in addition to that, we have to also take this into consideration, the unique PPE that we have to have with the COVID-19 in addressing COVID-19. Most of our FPUs or the form police units that are in the mission at the moment, they did not come with those COVID-19 PPEs. Therefore, we had to support them as well to be able to be equipped with PPE. Now at this time, so when we are dispatching our officers into the protection of civilian side to do the police duties that they're supposed to do, they have to be attired in COVID-19 PPE. There's no two way about it, so that we can prevent any cross-infection of COVID-19. And that's a challenge that we have. In addition to that, the mission also provided this the distribution of food ration. What we normally do is just a monthly food ration, but we had to prepare pre-position food before the onset of COVID-19, so that they at least have the food there with them, and that was one of the initiative that the mission also did, so that we can be in a position that we are ready when we are addressing COVID-19 within the protection of civilian side as well as outside. In terms of the AMPOL component, how that has affected our posture, we have scaled back a little bit in terms of the activities that we were conducting. We were doing most of this training of our South Sudanese National Police, and we were also doing this engagement outside of the community engagement. So we had to scale back a little bit in terms of our patrol and also our engagement, because when we do those normal activities that we were doing, it was drawing in a lot of crowd, and we cannot afford to do that when it comes to addressing COVID-19. So we had to change in terms of doing a lot more virtual engagement with our counterparts with South Sudanese National Police, so that we can maintain our network, and also at the same time, even in our workplaces, we have to do a lot more of social distancing and lightening up of the footprints of the AMPOL component within officers, and so we really had to shift and change our posture so that we can be able to address the COVID-19. So for the protection of civilian side, we're still maintaining our presence, a very light presence, but we respond to cases that comes up within the protection of civilian side, because even though we have the COVID-19 there, but we still have this to respond to some of the cases that are coming within the protection of civilian side. So say, for example, if we have a sexual and gender-based violence or cases of rape or some of the very serious cases that are happening, we still have to respond. But when we respond, we must make sure that our people are attired with PPEs, COVID-19 PPEs, to be able to address the situation and engage with our community leaders, so that we can be able to address this effectively when it comes to policing within the protection of civilian side. I'll stop there for now.
Thank you so much. And like you, when I heard PPE first, I was thinking helmet and vest, until now it's COVID-19. PPE is medical equipment. So we had to shift in my mind as from peacekeeping to PPE in a different context. So. Can I turn to Sandy again and just hear a little bit more from your experience working, especially on Ebola in Liberia? What have you drawn from that experience into your work now in UNMIC?
Thank you very much. Look, when Ebola crisis happened, the world was a different place. You may recall that the UN Security Council was unified. And when the crisis happened, they were unified. We don't have that now. And the dynamics surrounding COVID-19 are completely different. The economic, the political, the security impact, and the fallout of COVID-19 still remains to be seen. We are all in this together and we're all working from home. I think a year ago, if anyone had asked, you would have said, I don't think 2020 will be interesting, but it is. And within this ever-changing context, I think each peacekeeping mission is stronger now because of the Secretary General's management reform, where we can make decisions on the ground. We have the delegations of authority to go ahead and make the tough decisions. And I think this is kudos to him, if I may give kudos to my Secretary General. And because of this, when we established our COVID task force, our head of mission gave very clear guidance to number 2 deputy, to our chief of staff, and to me, that let's streamline the information, let's expedite the decision making, let's look at the risks, let's do the gap analysis, and let's put together mitigation measures in place. And thankfully, our head of mission, Mr. Tanin, is a medical doctor, and he said prevention, 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 planning, planning, planning. Now, we have here, based on my Ebola experience, we thought about worst case scenario. And the first thing from New York, what we had sent out to Liberia, to Sierra Leone, to Guinea, was that medical staff need to be trained, they need to have the equipment, they need to have the support. Yeah, and we need to ensure the supply chain is working, that we can get people in, assets in, and people out. And because the UN Security Council was unified, the international response was unified, the threat was very clear, the area was contained, the tracing of the cases was very clear. We don't have that luxury with COVID-19. The guidance given by WHO, by our UN headquarters, is very clear that we follow the national authorities' guidance. In Kosovo, all the borders are in lockdown. We can't go in, we can't go out. Only supplies that are going in are medical and cargo. So within the governance structure that we established, COVID Task Force and the delegation authority, have we done our best here at UNMIC? Have we learned our lessons from Ebola? Yes. The best practices that Rania can share with you, and I encourage you guys to look at our website and see all the best practice, not only for Ebola, for COVID, but all the good work being done on human rights, protection of civilians, on trust building can be found. We improved our medical facilities. Communication is key. We have here at UNMIC a very robust and effective communication strategy, not only with our headquarters counterparts saying, don't worry, all is in hand. With the national, local authorities, we have kept up our communication via WhatsApp, via phone, via Zoom, and other means. I personally deal on behalf of leadership here as the crisis management team leader here at UNMIC with the National Staff Union and the International Staff Union leaders and keep them informed. We have daily updates, weekly updates that we share with them directly. We have worked closely with the UN Kosovo team because my head of mission is also the head of all of the UN here. We work closely with our international partners. We have reached out to our regional partners and do regular updates to embassy representatives here as well. Business continues. Our life has changed, but within the realm of WhatsApp and MS Teams and others, business continues. I think the most important part for us now is day 71 of lockdown. June 1st is next Monday, and Kosovo is going to reduce some of the restrictions we have. Everyone has cabin fever, and now we're updating our contingency planning for phased opening of our offices. But we need to lead by example. We're doing something right that UN in Kosovo has 0 cases. We are lucky, and we're also doing something right. We will continue to be very clear on prevention and preparedness, but just in case, worst case scenario, we have our improved medical COVID-19 response for all of you in Kosovo team. And we're grateful to the regional countries around that for COVID and non-COVID, our medevac system is in place. And we're also grateful to headquarters, to Rania and others, senior leaders who have shared the medical, the medevac, the HR administrative updated guidelines. DMSPC, DOS, thank you. I'll stop there.
Thank you. Lydia, can I turn to you to just talk a little bit about how the Secretary General's call for a global ceasefire has it been effective in fighting COVID-19? Has it been successful in Mali? And with the ongoing fragile security situation, what challenges are you facing to address this pandemic?
Unfortunately, we continue to see that Malians experience a very insecure situation, very negative security situation. This is true for the Timbuktu region. This is true for other regions in Mali. I just saw one of my female colleagues who works in a different field office kind of send some information about intercommunal violence going on where women and children were being killed. In Timbuktu, in the past couple of months during the pandemic, Mali held elections. In Timbuktu, this occurred kind of under constant threat from terrorists, with several terrorist attacks threatening people from voting, kind of burning election material, threatening people, and also kidnapping the opposition leader just a couple of days before the first round of parliamentary elections, and he actually remains in captivity with the terrorists. So I see every day how our presence here really matters. I have great pleasure reading the reports, the feedback from civilians who say that when a patrol passes through their village, they feel much safer for a few days. Women can move around more freely, kind of they feel like they can resume their normal lives, which is why I think it's really important that we stay here, that we take the proper prevention protocols, such as wearing masks, not interacting too much with local communities, but still being in place. For me in my work, one of the kind of saddest days was when I had to, since one of my jobs is to liaise between the force and the civilians, was when I had to tell one of my officer colleagues who was planning an operation into a pretty remote village that I wouldn't be able to send any of the really important community liaison assistance with his operation because they're really important to him, since they kind of liaise with the community and explain to the community what's going on, what the UN is doing, and then also provide information back to the UN, back to us about what the situation in the village is. So this, we have to cancel these kinds of missions for now. I'll give an example also of kind of the security situation exacerbating the COVID response, and really a bit like making it very difficult for the COVID response. So just a couple of weeks ago, I was woken up in the morning with information coming in about the local health service vehicle with a team that was supposed to go into Timbuktu and take COVID samples to be sent to Bamako, the capital city, for testing, had been hijacked in the morning by some unidentified armed men, and then taken with all the testing equipment. Fortunately, the vehicle was later recovered along with the testing equipment. But after the Malian army kind of had to go in, there were some injuries. We were able to support them and help also evacuate those who had been injured. But I thought it was a really good example of kind of how difficult it is to fight a pandemic in these incredibly insecure conditions. And for that reason, we have to be creative with our support. We do our force, as I say, we continue to patrol. Our police continue to patrol wearing masks, and we shift to supporting also local radios who spread messages about how to keep healthy, how to prevent the spread of COVID. And we've also looked at how we can support the health authorities as well, which especially in the regions of Mali are not very well equipped to to treat large numbers of sick patients. So this work, I didn't mention it earlier, has become part of my job as well, to kind of coordinate if there's a request coming in from the local authorities in Timbuktu. You know, maybe they need help to transport large amounts of equipment, masks, hand washing materials, other medical equipment. I can make sure that this information, these requests, kind of get to the right people in the mission and in mission headquarters, so that we can quickly respond and quickly support with medical equipment. So it's challenging, and I think it's a little bit too early to tell kind of what the pandemic what kind of effect it'll have on ceasefires and levels of violence in general. I leave that to the political scientists to do so, but I certainly hope that the Secretary General's call to lay down arms will come true eventually, also in Timbuktu.
Thanks for that, and very candid, and I appreciate the challenging situation you're in, but you're continuing to do the best you can, which is incredibly more challenging during a pandemic. So thank you for that. I'm going to turn to Lieutenant Dr. Khadka. As a medical professional amongst the group, what's your day-to-day look like, and what are the challenges you're facing when it comes to capacity? Do you have enough PPE? Or what else? What are your biggest concerns when it comes to the pandemic right now?
I said a little ago, like the role actually has been almost the same, and then I wouldn't say there's I wouldn't say like a day-to-day, there's no particular aspect to say about it, since it's actually unexpected. It goes unexpected, but however, like I said, the activities has been going on, and the operational activities has been going on, and then so my role mostly would be on apart from the jobs I used to do. So it's additionally, I'll have to make sure that the troops, they go safely. So educating them regarding the preventive measures or the mitigation measures, like before they go on field. So making sure whether they are wearing the mask, or when they are on field. So if they are maintaining the social distance, and when they return back from the field, so if they are maintaining the hand hygiene or not. And then apart from that one, the other jobs would also be like also to check whether there is an adequacy of the hand washing facilities, the availabilities of the hand sanitizers, especially in the common places. And people know a lot about this disease being in an individual response, and it really depends on the immunity of the individual. So a part of it has also, my part has also been on checking whether our troops have been provided with the vitamin C supplements, like whether it be the lemon juice or the citrus fruit supplements. So those, if provided, then it's just one way or a measure to increase their immunity, so that, as we know, the diseases, mostly they are only mild to moderate, but it really depends on the individual's immunity system. So apart from this one, is also another challenge for me would be to train our own medical staffs regarding how to like if ever there is a suspected case, then how would we respond to it? So how would we approach on the suspected cases? So those would be a few of my challenges. And apart from the preventive measures, creating of an isolation facility, especially for the ones who are infected, or the worst possible outcomes, so which we cannot put aside as well. Another important aspect which I would like to highlight is that we still need to give continuity to the other medical services as well. Apart from, we know that the pandemic state is there in mind, but then there are other still people who seek for the other medical attentions, which might require like a referral, or an, as mentioned, there might be an urgent need of an evacuation. So how I feel right now is COVID, it has actually affected almost everyone. So whether it be from emotions to psychology, so it has somehow affected in every aspect of human being. And just one personal experience is that once I received a phone call from a female, and then she wanted a medical a consultation, but then she was just hesitant because of this COVID thing. So it has somehow created a fear amongst us. And it was found out that she's actually 3 months pregnant. So we did the necessary approach or the necessary things we had to do. But what I mean is that it somehow is creating a fear. But in a way, I was glad that she still has trust on the peacekeeper, and she approached me. She felt easy that easy to share her thoughts, her feelings. That's one. And then apart from this one, the protecting the troops actually, and then making sure that they apply these preventive measures. Um, it somehow is protecting the community as well from a possible source of infection. So in a way, we are helping the local authority by following all these measures when they go on field. So somehow we are supporting the local authorities to stop this spread, because the treatment is, it's really in query, it's in the process. But then the prevention is the thing we can do. But then long lasting, like what we always say in medicine is that prevention, it's always better than cure. So we hope that we do not have to get to that last resort, and we can sort it out way early. And as when a peacekeeper, when it goes into the community or in a society, whether it be a male, whether a female, we are looked upon as an example. So when our troops, they go out on a field and they are wearing a mask, they're maintaining a social distance, they're maintaining the hand hygiene, not doing handshakes, which initially used to be a friendly gesture. So by not doing all those, somehow we are educating the society, educating the community against COVID-19. So it's like awareness by creating us as an example. So I make sure, so one of my biggest role right now is to educate the troops when they go out in the field, so that they couldn't get the disease themselves, and also they couldn't become a vector for the others as well. So apart from maintaining the peace and the security. And some challenges which we face would be things like the limitation in the medical supplies, because of course there are restrictions to the movements, except for the operational activities and the other emergency activities. There are still limitations or restrictions, and because of which even the local purchase of the medical supplies, sometimes that's a challenge. Apart from that one, then a complete set of PPEs, like earlier, I think it was mentioned, personal protective equipments won't really apply to a helmet and all, but the new context in case of COVID would be wearing of a mask, the eye shield, completely covered from the head to toe. So in order to get yourself against the germs or the disease or the causative agent, so to protect yourself from the causative agent, that's personal protective equipment. And how I say is that like a soldier cannot go into a war without a weapon, because he needs to protect himself in order to protect the others. It's similar for anyone. The disease, it's like a war, if we say, and then personal protective equipments would be like a weapon. So, but our challenge right now is the limitation of the complete sets of PPEs. We do have the mask, the gloves, but then the whole set of PPEs, there is limitation to it, the number. And then when it comes to diagnostic side, we also have limitations to the testing kits, because those are especially available over the higher centers and the capital cities, so which puts us, like especially we are right now in level 1, so we have a sort of like limitations to the testing kits. And very neglected side of this disease is also the fear amongst us, the phobia. Like I think in every one of us, this fear. This is also a challenge to me actually, and the psychological stress that people are getting from this disease. So this is also a challenge which is actually taken as granted, but actually is a major challenge. But apart from that one, apart from all these things, the main challenge remains the disease entity itself. Because right now, this COVID, it is itself a new disease. It's emerging, and it has actually challenged the whole medical field. But despite of this one, like what we right now know is just the preventive measures, and to update ourselves with the latest facts, the figures, the latest protocols, and the guidelines. That is the most vital thing right now. Like, I would like to highlight on this fact that the recent the halt by WHO on the use of the hydroxychloroquine, so which was actually used as a clinical trial in certain countries to treat COVID. But then later on with the studies, it has been found that it has no benefit,
Sure.
and rather it has increased the risk of dying of the patient from COVID-19. So updating ourselves with such would also be a challenge, and then to go against it. So it's always a challenge since it's still in the evolving phase.
Yeah.
But one biggest rule will always be to keep safe, to keep ourselves safe. So going towards the treatment, rather, we would go on the preventive measures more.
Well, that
So
makes sense.
apart from the challenge, that is something we can do it despite of the limitation. Preventive measures are something we can do despite of the limitations. So, yeah.
Thank you so much. So I have more questions, but I'm going to turn to Q&A because I think the questions are piling up and I want to make sure our audience has a time to ask some questions. So Farah, can you take a look at the questions for us?
Yes, thank you. We had some excellent questions in the Q&A box, but due to time, I think we will open up only one or two. This question is directed to Rania. Rania, because most of our audience is living in the US, a question from an anonymous attendee asks whether UN peacekeepers would ever be able to support a mission in the United States. And also, how can Americans support UN peacekeeping?
Thank you very much for the questions. One very easy and straightforward, one a lot less so. I think I'll start by how you can support the United Nations, and certainly this association is one of our main platforms that helps us explain what the UN does and what peacekeeping does, and to seek your support. You well know that the United States is one of our biggest financial contributors in peacekeeping, and that continues is of vital importance for all our missions and all my colleagues that you just heard speak in how they're responding to COVID, and how they're protecting civilians, and in how they're trying to create political space for political solutions to hold, because ultimately that is what every mission is out there to do. And you play a vital role in trying to keep your legislative bodies basically aware and pressurized about the importance of being key players in this organization as you were founders. So certainly advocating for arrears by the US to be paid would be very welcome. Advocating to continue to play a critical role in this organization, of which you are also a permanent member of the Security Council, is critical. And engaging in initiatives like those are also very important. We welcome and would be happy to engage in expanding and explaining more on what we do. So please reach us at any time, and we will do so. I think can the United Nations help a member state in response to a crisis in their country? The United Nations supports, and based on a Security Council mandate, of which, of course, the US is a member, missions where there is a need, where the government has had a breakdown in law and order, where it's a significant conflict and there's need for response. And we have a wide array of tools that we deploy. Peacekeeping is only one of those. It is one of our most visible, where there are uniformed troops, police, and military and civilians. But we also have political tools, and we have humanitarian tools, and we have development tools. So it's a very wide range that the United Nations can go in and help member states with. Over to you, Chandram.
Thank you. Thank you so much. I think we might be on close to time. So I just wanted to say, quick thank you to all the panelists and appreciate the candid remarks. Since, you reminded us that our audience is US and UN peacekeeping is, cost-effective means for the US to enhance its foreign policy and security interests. And right now, the U.S. Is $1 billion in arrears. So it's really important that we do advocate for UN peacekeeping. And I appreciate UNA USA members always doing that for us. But I wanted to end today's conversation like our former president, Kathy Calvin, used to do with a Eleanor Roosevelt quote, which I think holds very true with the strong woman on this panel today. A woman is like a tea bag. You can't tell how strong she is until you put her in some hot water. And all of the women today have really exemplified how they have found strength and really persevered in their mission and the work that they do here today. So I'm going to turn it back over to Farah for last kind of UNA USA things. But thank you so much for the panelists and for the incredible work that you've done.
Thank you, Chandrima. I would love to echo thanks to each of these incredible women who have indeed served on the front lines to keep peace, even during a pandemic. Peacekeeping is an important part of the United Nations, obviously, as we've heard, and a very important reason to ensure that our members of Congress also agree to keep fully funding all aspects of peacekeeping. For that reason, please consider joining UNA USA for our week of action to collectively share our voice to support UN initiatives like peacekeeping. So to do so, you can visit us at unausa.org/united-together. And another opportunity to ensure your voice is heard, even at the highest levels of the United Nations, is to actually participate in a consultation, otherwise known as an interactive dialogue facilitated by us at UNA USA. Join one in your area or join our nationwide consultations by visiting unausa.org/UN75. And of course, last but most definitely not least, join our movement. You'll be in good company with over 20,000 other Americans who strongly believe in the values and the principles of the United Nations. Visit unausa.org to learn more and to become a member. And with that, I would like to thank you once again to our panelists, to our moderator, and to you, our attendees, for joining our GEO session. And we hope to see you at another UNA USA virtual program soon. Take care.